So I'm not going to talk specifically about Pectus surgery because it's not just about Pectus surgery anymore. It's about Pectus care. Where are we in September 23? Okay, so let's just go back. 2019, Pectus surgery was decommissioned in NHS England. Uproar. A few services limped along. Some of them kept walking. Not many places were running. And battles broke out between impassioned clinicians, some patients, and the commissioners and the administration at NHS England. And it ended with a complete standoff and people being threatened in both directions with GMC, legal suits, and so on. COVID. We got through COVID. And so last year, we started making a plan. We gathered together, and there were lots and lots of people, but I have to particularly mention Simon Kendall, Joel Dunning, Ian Hunt, Babu, Sri, Karen, and more people than I can remember. Narain as well. And really, it came down to putting patients together, designing a pathway, and getting participation. And by participation, by finding the allies within the health administration who we could work with. So we, SCTS, set up a Pectus Engagement Day, which was run in February of this year at the Royal College of Surgeons. And at that meeting, we had patients. And this is Lynn Evans with her book, Pectus and Me. She's the mother of Pectus patients. And we had a great deal of help from our colleagues in the SCTS team. And we had lots of patients in the library downstairs and their families, and we had experts in different areas. Margaret came from Wales and spoke. We had Anne Child, the geneticist, and we had people from NHS England talking. And in April, we managed to get Pectus surgery recommissioned. Now, it didn't happen directly as a result of the Pectus Engagement Day. We were working on it intensively through the latter half of 2022, but certainly the patient element helped to focus the attention, and we got Pectus surgery recommissioned. We also got the urgent designation of a first national centre at Barts, and we had to drive that through. And we chose Barts because they had a Pectus programme, they were doing some children, and it's very accessible. It's at the centre of lots of transport links. In April, the national MDT opened online, and in July this year, we started surgery at Barts. Now, what I want to say is, sorry, that's the commissioning document. And those are the criteria that Narain mentioned earlier on. So it had to be severe Pectus with a Haller index of 3.25 or more, with an arrhythmia, cardiac symptoms, evidence of cardiac compression, dysphagia caused by the Pectus, so only excavatum, or other problems due to the Pectus and they had to have it treated for them to be treated for the other problem. So we started the surgery, and then about a month after the surgery started, we went to Barts and we did a site visit and have issued or prepared a document which has now had to go through some process, and it's going to go back to Barts so that they can build their service. But they are doing the operating. We also, in July, actually put out the call for a second national centre, which has to be in the north of the country. And we have received bids. Thank you very much for everybody who bid. And we are now going through an exhaustive bid review process. And this is the first bid review process I've been involved with, but it is extremely thorough. Simultaneously with that, we've produced two important documents. One is a simple pathway, which is has been widely circulated to stakeholders and we're waiting actually for the British Association of Paediatric Surgery to give it its sign-off. And also we have, led by Joel again, prepared what is entitled the Pectus Care Guidelines, which are joint specialty, multi-specialty, evidence-based guidelines for the management of Pectus patients, which covers not only surgery, but the other aspects, in particular the non-surgical treatments of bracing and the vacuum bell treatment. There's also been the submission, as Babu mentioned, of a proposal for a multi-center randomized controlled trial, which is being led by the Middlesbrough group, by Enoch and Joel, but also it has several centers participating. So that's where we are with Pectus Care. I think that one of the things that is very important for me to emphasize is that this isn't just about the surgery. Scotland actually has a very good Pectus Care model running, and what's clear from there is that about 90% of the work is not actually operating. It's about bracing, vacuum bells, and some psychological support as well. So that's where we are with Pectus. And I'd just like to remind you as well about the joint study day. If you haven't booked for it, you can scan that QR code and it takes you to the event booking page. Please come along, because we need our anaesthetists as engaged with us as possible. Thank you very much.